Morning everybody, Dr. Blumenthal back with you in the Bethesda office at Natural Transplants, and today we are excited to have Jack with us. Jack is coming in locally and I'll let him tell the story, but I appreciate you sharing your story with everybody. Hopefully this will help other people that are looking around and inspire them. Appreciate it, thanks.
Yeah,
Welcome.
Thank you.
Yeah, if you wouldn't mind sort of sharing with everybody what brings you to us.
Sure, glad to help. So thanks, Dr. Blumenthal. My name's Jack. So I came here. I have a history of asthma, and some of the treatments kind of led to some accelerated hair loss, which is my scalp. I had an FUE done in 2017. Went great, but just trying to kind of thicken up some of the areas, especially kind of around the front, kind of around the hairline and the crown primarily. And got some great recommendations of this place, good reviews, and happy to be here.
Awesome. Thank you so much. I'm going to have Jeff, zoom in a little bit. I'm going to just put your head down just slightly, just so we can kind of see. And it looks like with the FUE, they did the front, the frontal third, and the crown, and they did good work. But there's only so much you can do with the FUE. The hairs are all kind of one hair grafts, and oftentimes it doesn't give you that thickness that you want. It's great for the hairline, that sort of stuff. But we're going to kind of thicken it up a little bit, give it a little bit more density, and then up in the crown. Not bad coverage up in the crown, to be honest with you, but it's a little bit light, so we're going to kind of thicken this up as well too. So that's the goal today, just kind of thicken things up. May or may not bring the hairline down slightly, but that's our last priority. Otherwise, sort of priority one will be sort of the front of the frontal third, crown, back of the frontal third, and then we'll sort of go from there. So you're excited? Get ready?
Yeah.
Awesome. Thanks for doing this. We'll draw everything out, do a little bit of shaving, and then we'll check back in with you. Cool?
Outstanding. Yes.
Awesome.
Thanks for the flow. Appreciate it.
Dr. Blumenthal back with Jack, and as you can tell, we've done a little bit of shaving. Interesting hairstyle, but we think it may work for him. He's got some Zoom calls and that stuff coming up, so we actually kept our third priority, the hair in the third priority. If we can't get there, it may help with some of the coverage, but in any event, didn't really do much. We brought the hairline down just ever so slightly on one side just to kind of even it out, and dropped it just a touch. But for the most part, I'm going to have you drop your head, Jack, just for a little bit. This will be priority number one. Most of the frontal third. Priority two is going to be in the crown, back up in here. You can see that width. Mm-hmm. And then priority three will be kind of in this tuft of hair, which still has some decent density. I'll shave that if I need to later in order to go in there if we have extra, if we can get that plus procedure. So that is the plan of attack for today. We've got one Valium on board. Doing all right?
Yeah.
You excited?
Yeah.
Let's do it. All right, we'll catch you a little bit later.
Sounds good.
Awesome. All right, everybody, welcome back. Jack has made it. Congratulations, man.
Thank you, sir.
Be honest, how was the day? How'd it go?
Outstanding. Very cool. Very cool group here. Even I get introduced to the Squid Game too. It's kind of part of the process.
Yeah, you're addicted now.
Exactly. I got a Netflix assignment.
Today went awesome. I'm really happy with the line. We got a lot of good hair on you. Really packed it in tight on both sides. We were able to finish, number one priority, number two. Did not have enough to go into three, but you got plenty of hair up there.
Outstanding.
So I'm going to have Jeff just zoom in a little bit. I know I said don't bend your head, but just ever so slightly, just right there.
Right there.
So we've got a new hairline, really filled out the frontal third. I'm going to swing you around. You can see the crown. Built that out. I'm psyched. I'm really psyched about it. We have a wrap on you. You had a little bit of oozing. Incision looks beautiful, but it's just a little oozy, so we didn't want to get your clothes all messed up.
Outstanding.
So that can come off tomorrow. Otherwise, you did great. Welcome to the family. Congratulations.
Yes.
Appreciate you doing this for everybody at home that can kind of learn about this.
Absolutely.
Hopefully it can help them, and hopefully we can kind of follow you along and see it a year and see the transformation.
Outstanding. Yeah.
Fantastic. Any words of advice or offer to anybody out there looking around?
Yeah, it's a kind of great service, great team here. Dr. Blumenthal and Jeff and Zane and Kenza, just really wonderful. They kind of keep you comfortable while you're there, and just kind of a wonderful facility here. And I mean, even kind of a little education as a bonus. So.
That went both ways. And you taught us a lot of stuff too. That was fun. You had a good day today.
Yeah, wonderful day. Yeah.
Good day. Well, appreciate it. Again, welcome to the family, and hopefully, we'll see you in a year and see the nice results.
Yes.
Awesome.
Looking forward to it.
Sounds great. Thanks so much.
Thank you.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.